I would like to request His High Commissioner to mention something about the partnership that India and Kenya has had over the years and what can be planned for the future. Thank you.
Thank you, Dr. Shesh. To begin with, I would like to congratulate a wonderful set of Indian Kenyans here, who took this initiative of organizing this discussion on India-Kenya Healthcare Cooperation in the larger framework of Kenya Vision 2030. And when I was first introduced to the larger concept of this event, I instantly said yes, because the proposal was to have it in the larger context of the celebrations that we are having in Kenya of 75 years of India's independence. We call it Azadi Ka Amrit Mahotsav, or India at 75. Before I come to the main theme of India-Kenya medical cooperation or healthcare cooperation, I would like to say that it is something which is embedded in the traditionally strong friendship between India and Kenya. This friendship is as old as over 100 years, when neither of the two countries were independent. And when it comes to celebrating major events, major dates in either of the two countries, the High Commission of India is always very forthcoming. Our relationship covers a series of areas, and healthcare cooperation figures as one of the top priorities that we seek to build, that we have always traditionally sought to build. We have come a long way. We have come a long way in this particular sector, and it became all too visible last year. I remember when CS Health, Dr. Kagwe and I were at the airport to receive the first consignment of made in India Covishield COVID vaccines here to Kenya. That was very, very satisfying for us. But that was something which was in the background of what we have already achieved. Whether it is the so-called medical tourism, whether it's about the availability of Indian pharmaceutical formulations here in this country, whether it's about Indian vaccines, whether it's about healthcare technologies, whether it's about ambulances or even radiotherapy equipment like Avatron that is functioning, treating thousands of patients, improving the cancer outcomes in Canada Hospital. So there has been a large background of what we are doing. But today, what I thought we could do very briefly is that, with the presence of Excellency, the Cabinet Administrative Secretary, Dr. Mercy, in India, Excellency, we describe your position as Minister of State. So, you are the Health Minister representing Kenya today. And I'm very excited that we have a wonderful set of clinical practitioners here, from the hospitals in Nairobi, hospitals in India, and also we have an expert, Dr. Lakshmi, representing traditional medicine. She is a well-known expert in naturopathy. So with these words, I think, Dr. Sheth, I would like to hand over back to you, and then we get started.
Thank you.
Thank you.
I would now like to request His Excellency, the High Commissioner, for his comments on all the opinions that have been given and the comments.
Thank you, Dr. Sheth. I think it's a big challenge to my grey cells, but let me try to recall. Let me see how much I can recall. I'll begin with what Dr. Lakshmi said about naturopathy. Now, traditional medicine is something which is basic to all societies. All societies are based on traditions, and the art and science of healing is something which is embedded in all traditions. I've seen this in Kenya, when I visit counties and meet different tribes. In India, it is very well established. We even have a ministry of Ayush, which is dealing exclusively with traditional medicine. And I find that here in Kenya, the traditional medicine enjoys a lot of resonance on the ground, and this is an area which we can jointly develop, whether it's Ayurveda or naturopathy and other such sciences on the traditional sides, both in India and Kenya. In this context, let me share with you that precisely 10 days from now, on the 19th of April, in Jamnagar, in the state of Gujarat, the Global Center of Traditional Medicine, which is WHO mandated, is going to be inaugurated. There in India, there are participants confirmed from a number of countries. A lot of impressive international participation, including from Kenya. They're going to be also a global summit on this thing, where we hope that this particular area of cooperation will find a lot of oxygen, as they say, in the times to come to develop this thing. In addition, I'll come back to a couple of points made by Her Excellency the CAS. What I learned today on the NHIF front, this is very important, because the governments are dealing with the constraints and challenges in addressing the global goal of UHC, and all countries are dealing with this challenge in their own ways. It's very heartening to hear from you, what you said, and the differences making on the ground. In a line or two, I would like to mention that back in India, we have a program called Ayushman Bharat. It is not exactly the same, but it is along the same lines, to give insurance cover to the entire population with a particular focus on the less privileged ones. And there are fixed figures of giving the families the insurance cover, and the treatment that is provided to the patients covered by Ayushman Bharat is another, I would say, rather successful model of private-public partnership. Since both Her Excellency and I, we represent governments, I would like to inform that at the G2G level between the two governments, we are looking at a memorandum of understanding on healthcare cooperation between the two countries. It is at a very advanced stage, and in the coming weeks I think it should be ready for signature. And that document talks about the various areas where we can work together under mutually agreed terms and conditions. And it covers cooperation in the field of medical education, in capacity building, even new practices and learning from each other in patient care, and also what we can do together in the field of traditional medicine. We have also talked about, a little bit before we really got on camera, about vaccine manufacturing. Now, I won't, overemphasize the importance of India internationally, in terms of vaccine manufacturing capacities. But even pre-COVID, close to 70% of the global vaccination production was in India. Now, COVID has taught us some lessons, and how international collaboration is the way to go. And India-Kenya collaboration in vaccine manufacturing, I think it holds a great promise. And in the times to come, we are going to talk more about it, and how we can bring manufacturing facilities to Kenya through negotiations by agreeing on various terms and conditions, and also agreeing on the respective obligations of the two sides, including through the participation of the private sector. And now, coming to what my friend Dr. Malkeet Riyad said, I mean, today, I'm convinced that he is one of the top, most distinguished clinicians of Kenya and also an academic. And in his very brief comment on his specialization, which is hemato-oncology, blood cancers, the need to have more predictable, reliable and affordable facilities for bone marrow transplantation. Expertise exists in India. There is a willingness to do things, between India and Kenya. I think both in the public sector and the private sector, we need more conversations to bring that expertise, that facility from India to here, either by way of setting up some joint facilities or even by inviting some bone marrow transplant experts from India at periodic intervals from time to time. They do the procedures here, go back, and the Kenyan institutions, the Kenyan hospitals providing the basic facilities. And in the process, I'm quite convinced that as we go along down this road, there will be considerable improvement in terms of capacity building or skill upgradation among the Kenyan clinical community. Dr. Sunil mentioned about his own setup in India, his own experiences of international medical cooperation. I think it was very, very useful from hearing from you on various points. The setup that you represent here in this room today is representative of a number of world-class medical facilities that exist in India today. And so many of them are already active in Kenya. I'm not too sure whether medical tourism is the right word or the right expression to use, because patients who go to India for treatment, they barely go outside their hospital room, and it's not a leisure activity at all. It's all about the healing of the sick. But it's important, you need to go. And in my 18 months of stay here in Kenya, I find that some of the specializations that you mentioned, they are very important. And there are facilities, including on the private sector side, where you can meet the needs here, whether it's neurosurgery or cardiac surgery or transplant surgery, bone marrow transplantation, critical care medicine, trauma surgery, nephrology, renal transplants, dialysis, even mental health. These are the areas, where we need to focus, and we can do it. We can do it. And we have to find ways and means, more conversations, more interactions, in a very result-oriented way, where we agree on, the terms and conditions of what needs to be done. And here, I think we'll go a long way if we are able to jointly create the enabling conditions to have facilities here in Kenya. Because, I know that when a patient goes from Kenya to India, it's expensive. It's not just the doctor's fees or the hospital room. It's flying to India, staying in India, the hospital procedures, surgery, stay, and the rest of it, cost of medicines. I think we need to look for solutions where the cost to the patient comes down, and comes down dramatically. That could be, I think, a shared goal for all of us to achieve. Dr. Naomi's story, I think, is both amazing and inspiring. A Kenyan doctor, after the primary medical qualification here in Kenya, going to India for specialization studies, and coming back to Kenya and heading the pediatric cardiology program in the country's largest hospital. I think it's amazing. Congratulations to you, sir, from what you are doing. Now, coming to the more substantive part of what you mentioned, sometimes the need to consult a specialist back in India, whether it's post-op care or follow-up, or even sometimes ab initio, the OPD kind of care. Sometimes even, reading of the scans, the radiology kind of thing. There we could perhaps tap the potential of telemedicine. I remember at one of the meetings that I attended here in Nairobi a few weeks ago, a very senior official from your ministry, he told me, he said, a top hospital approached me that, sir, I don't have, many radiologists. I just have one radiologist, so please arrange for me 2 more radiologists. And that senior official, he said, you don't need radiologists, you need a good internet connection. You need connectivity, you need more bandwidth, reliability, so that you can exploit the potential that's available through advanced technology. So telemedicine is another area we can work together. So, in short, what I believe, and I genuinely believe, that there are so many things which are doable. They are waiting for some final touches, and those final touches could be given jointly, both at the G2G level, and perhaps more importantly, and in terms of scale, at private to private level, with of course the support of the 2 governments. I think that's the way to go in